Ready? And remember, where do we breathe into? Our bellies, and where do we breathe in from? Our nose and out through our mouth.
We know that mental health impacts the entire family, so mental health is a big deal. And we want our students, we want our families, and a community at large to know we, the Savannah-Chatham County Public School System, takes it very seriously, and we are here to offer support. We also realize that we cannot do this in isolation. Our best job, our best work is done in a collaborative effort. So we partner with many of the community service organizations. We communicate and collaborate with juvenile court, with state court, with the peer mediation center, with Loop It Up Savannah, with Gateway Health Services, with the Department of Family and Children Services.
There is a very strong network of nonprofits and community partners here in Savannah. We're so fortunate to have such a rich community of people that care and people that are open and creative about how to collaborate. So there's a whole group of partners that are focusing specifically on collaborating with the school system on how to build resilient schools and how to help children and teachers and families access as many services and supports as possible.
One of the biggest challenges our children face in our community is a lack of mental health resources. We've found that in our court, approximately 62% of the children coming in for delinquency cases have a mental health diagnosis. 70% of those children are untreated.
Your mental health is a part of your overall physical health. It impacts all parts of your life. It's all about that preventative care. You know, we go and get our checkups once a year. To make sure, you know, as far as our height and our weight and all of those things, that we are progressing as we should, or if we need to cut back on certain things, we take that advice. Same thing with your mental health.
When a child ends up in my court, I'm always wondering what is it that could have been done to keep that child from coming here in the first place. And that's one of the reasons we created the front porch, to intervene early. The school system is an active partner in that program.
The Front Porch has a collaboration with the school district daily, really, because of a couple different things. Number one, most of our referrals for kids to come in and do the assessment and get the interview done with us, most of those referrals come from teachers. So we have a direct collaboration with them in that sense, but then also we have people on our staff that work for the Front Porch and then also work for the school system. So we have a really cool direct collaboration in those two different ways.
No agency or entity can be everything for everybody. And what we've learned is that by collaborating, we're able to leverage the resources of our partners to do so much more for the children and families in our community.
The school system, wanting the best for our students, has reached out to all of their community partners, including the Mediation Center, to figure out how can we best collaborate to ensure the best for our students. We're so grateful for that because we each have this big desire in our hearts to help our kids. They're going through so many challenges these days, all different kinds of social and emotional challenges. And there are many partners in the community that have curriculum, they have trained individuals, and the school system partners with us in that way, letting us in and figuring out how collectively we can make a bigger impact for our community.
It's a new initiative to address childhood trauma and quickly. Savannah Police are working alongside with Savannah-Chatham County School District to be proactive in that approach.
We have partnered with the Coastal Georgia's Indicator Coalition, who has formed a partnership with several local police municipalities, and we now have a program called Handle with Care. And what Handle with Care does, if a police officer encounters a young person who has had a traumatic experience, they get that student's name, they get that student's address and that phone number, and they make the school aware of it.
No, the thing we don't want to do is wait till that crisis show up at our doorstep, where that child has been traumatized. We want to get them help is at the earliest stage that we can so they can come to school and learn.
We really want our students to have all of the tools and the skills that they need to be happy, to be healthy, and to be resilient. And we know that positive childhood experiences, genuine and caring connections really nurture those skills and help our students become the strongest, most vibrant versions of themselves and the best members of their school community, as well as their neighborhoods and the Savannah community at large.